everybody. Welcome to our presentation on the relationship between dating apps and sexually transmitted infections. My name is Eliza Beltran, and my partner is Katherine Wooden. Our project goals. We want to investigate how the rise in dating apps use correlates with the fluctuations in STI transmission rates. And we also want to analyze the impact of dating apps on public health, focusing on how they may contribute to riskier sexual behaviors. We'll also be investigating any health implications. Description of STIs. It is spread through sexual contact. Examples of them are chlamydia, gonorrhea, syphilis, HIV, HPV, and more. Some risk factors are linked to multiple partners, unprotected sex, or sex while under the influence. And how can it impact your health? It can lead to infertility and pregnancy complications, mental illness, and in severe complications, cancer and severe chronic illnesses. These are some figures. The first one is from the Cleveland Clinic, just showing you tips to lower your risk of developing an STI, like abstinence or not having sex, using protection, like a latex condom. Other forms of contraceptive may not prevent STIs, choosing sex partners carefully, or just having one, getting checked for STIs regularly, avoiding drugs and alcohol before having sex, since it can impede your behavior, and learning the signs and symptoms of STIs. And to the right is the Talk, Test, Treat campaign from the CDC. This was showcasing the statistics from 2021, especially in the face of the pandemic. STIs will have been at an all-time high, and especially for vulnerable groups such as young people aged 15 to 24, gay and bisexual men, pregnant people, and racial and ethnic minority groups. And this is showing the financial impact that STIs has had on the US healthcare system. It has reached 16 billion in direct medical costs, and 1 in 5 people in the US can have an STI. And this is further statistics, specifically from the CDC 2022 STI surveillance report, especially after the changes that COVID-19 has brought us. Syphilis, which is an STI that is most often not seen in the beginning early stages, has increased. And chlamydia and gonorrhea are still relatively high in numbers, but have a slight trend neutrally or slight decline. Now, what is the significance of the problem? Higher STI risk due to increased casual encounters from dating apps, and dating apps are correlated with unhealthy behaviors like inconsistent condom use. Disparities in impact. So young adults, lower income, LGBTQ, and urban populations are most affected, most likely because of funding for education regarding this manner, and younger adults may feel less susceptible to STIs just because most individuals may be young and healthy. And then public health economic burden. There's increased healthcare costs and mental health stigma regarding sexual behaviors. And then there's an urgent need for safer sex education and more STI screenings on various social levels in society.
In conducting a literature review on the correlation between dating app usage and STIs, we performed searches in databases such as PubMed, Google Scholar, the CDC, and reputable news agencies. We used information that was collected between 2010 and 2024, which covers the period when dating apps saw rapid growth. We used search terms such as dating apps and STIs, public health impact of dating apps, and online dating and STIs, among other related search terms. Our review of relevant data indicated that there is a statistical correlation between dating app usage and STIs. When comparing dating app users and non-users, there is a higher prevalence of STIs among dating app users. This association is partly due to the ease of access to new partners, which can increase the likelihood of riskier sexual behaviors. We determined there are economic and emotional costs associated with our findings. Economic costs include increased costs due to the need for more frequent STI screening and medical treatment for those diagnosed with STIs, as well as some emotional costs associated with being diagnosed with an STI, such as mental health concerns like stigma, depression, anxiety, low self-esteem, suicidal thoughts, shame, and embarrassment. One AI tool in particular is currently being explored to address dating app usage and the rise in STIs, and that is machine learning. Machine learning algorithms are being explored for their use in sexual health programs, as they are able to track STI outbreaks and predict areas of higher STI risk based on app data. There are ethical considerations, however, including data privacy and bias. Regardless of the benefit that dating app data could provide to public health, dating app users reserve the right to have their data remain private. Along with those privacy concerns, AI technology could introduce bias if the algorithms incorrectly target or stigmatize certain groups. So addressing this issue from a public health perspective could include methods such as targeted promotion of STI screening among high-risk demographics, such as young adults in urban areas and members of the LGBTQ+ community who use those dating apps. The advocacy for new health policies could have a great impact. Helpful policies could include guidelines surrounding how dating apps share user data for public health initiatives while respecting users' privacy concerns. Also, policies could require dating apps to use warning labels within the application to warn users of potential risks. Those would be similar to tobacco product warning labels on their packaging. The practical and clinical implications, health educators and health professionals in general addressing this issue have the responsibility to educate their priority population and patients on safe dating app usage and safe sexual behaviors, as well as STI prevention. Health professionals, as always, have the duty of reporting all nationally reportable STIs as well. So in conclusion, just to go over some of what we've discussed, their research has revealed a significant correlation between increased dating app usage and higher STI transmission. This phenomenon calls for targeted STI screening practices, increased sexual health education, and advocacy for public health policies. AI could be a powerful tool to address this issue. However, all ethical issues must be considered before implementation of AI technology. Ultimately, health professionals and health educators are responsible for educating their patients on safe sex practices, safe dating app usage, and the continuation of reporting all nationally reportable STIs. Thank you so much for your time.